Hello everyone, and welcome back to our channel. If you're preparing for the UKMLA or Plab exams, you're in the right place. At MedRevisions, we're here to help you ace your exams with comprehensive study materials and in-depth question breakdowns. Today, we're diving deep into a clinical scenario that challenges your understanding of palliative care and respiratory management. And this exam question appeared in the August 2024 Plab 1 exam that was based on the MLA content map. Here's the question. A frail 85-year-old male with a history of squamous cell carcinoma is currently under palliative care at a hospice. He presents with a sudden onset of breathlessness over the past 1 to 2 hours. He has a history of smoking. On examination, his vital signs show a heart rate of 95 BPM, blood pressure of 110/70 mm mercury, and an oxygen saturation of 88%. Physical examination reveals decreased breath sounds and increased tactile and vocal fremitus on the left side. Neurological and mental status examinations are unremarkable. What is the most appropriate management? And the options are: A. Start high-flow oxygen therapy. B. Perform a pleural tap. C. Initiate antibiotics. D. Increase palliative medication dose. E. Arrange for an urgent CT scan. Now, take a moment to think through this scenario. It's a common presentation in a palliative care setting, but it's essential to know how to approach it systematically. Let's break it down. First, let's analyze the clinical scenario. We have an 85-year-old male with a known history of squamous cell carcinoma, which has now brought him under palliative care. He presents with a sudden onset of breathlessness. The clinical findings, such as decreased breath sounds and increased tactile and vocal fremitus on the left side, along with an oxygen saturation of 88%, are crucial here. What do these signs indicate? These symptoms suggest a pleural effusion, which is an accumulation of fluid in the pleural space. Given his history of squamous cell carcinoma, this is highly relevant. Let's dive deeper into why pleural effusion is likely in this case. Pleural effusion can occur in patients with malignancy due to several reasons: direct tumor involvement of the pleura, lymphatic obstruction, or secondary infections. In our patient, his history of squamous cell carcinoma and the sudden breathlessness align perfectly with this diagnosis. But how do we manage this effectively in a palliative care setting? The correct answer here is B. Perform a pleural tap, also known as thoracentesis. Let's explore why this is the best management option. Performing a pleural tap serves two critical purposes: diagnostic and therapeutic. Immediate symptom relief. It directly addresses the patient's breathlessness by removing the fluid, providing rapid relief, a priority in palliative care to improve the patient's comfort and quality of life. Diagnostic benefits. It allows us to analyze the fluid, determining if it's exudative or transudative. Given his cancer history, it's likely exudative, but confirming this can guide further management and ensure there's no secondary infection or other pathology involved. Now, let's look at why the other options are less appropriate. Option A. Start high-flow oxygen therapy. Oxygen therapy might improve saturation temporarily but doesn't address the underlying issue, the fluid buildup in the pleural space. It's not a definitive treatment here. Option C. Initiate antibiotics. There's no evidence of infection, no fever, no purulent sputum. So antibiotics aren't indicated in this situation unless there's a concurrent infection, like an empyema. Option D. Increase palliative medication dose. While increasing palliative medications such as opioids might reduce the sensation of breathlessness, it doesn't treat the cause and could lead to undesirable side effects like excessive sedation. Option E. Arrange for an urgent CT scan. While imaging could offer a detailed view, it's not immediately necessary for a suspected pleural effusion, which can be diagnosed with a bedside ultrasound or chest X-ray. Remember, in a palliative care setting, our primary goal is immediate symptom relief. So, what's the next step? After performing a pleural tap, it's crucial to monitor for any complications, such as pneumothorax or re-expansion pulmonary edema. This can be achieved with careful clinical observation and possibly follow-up imaging, depending on the clinical scenario. And always discuss further management options with the patient and their family, considering their wishes and the overall goals of care. And there you have it, a comprehensive breakdown of a challenging exam question, perfect for your UKMLA or Plab preparation. Remember, at MedRevisions, we have over 5,000 exam questions and study notes covering the entire MLA content map. Make sure to visit our website at www.medrevisions.com to access more high-yield content like this. Don't forget to like, subscribe, and hit that notification bell so you don't miss out on any future videos. Thank you for watching, and good luck with your studies.